Congratulations, you're now board certified in addiction medicine. These are words you might hear in just a few years. How has addiction medicine reached this stage? What does it mean for us? And what does it mean for our patients? I'm Dr. Stu Gitlow. You're listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. With me is Dr. Kevin Kunz, Program Director at the Big Island Recovery Center in Kona, Hawaii, and Interim President of the American Board of Addiction Medicine. Thanks very much for joining us, Dr. Kunz.
Thank you, Dr. Gitlow.
Tell me a little bit about the certification options that are currently available for physicians who specialize in addiction.
Well, currently, a certification is available from the American Society of Addiction Medicine. There's also a certification at the level of the American Board of Medical Specialties in Addiction Psychiatry. And there is a difference there between addiction medicine and addiction psychiatry. The addiction psychiatry subspecialty is under the field of psychiatry and is recognized by the American Board of Medical Specialties. And the certification from the American Society of Addiction Medicine is not an independent board, and so it doesn't meet the criteria to apply for or be a specialty or subspecialty under the American Board of Medical Specialties.
So if I understand correctly, a psychiatrist could become ABMS boarded in addiction psychiatry, but a non-psychiatrist would have no choice other than the ASAM certification, which is not part of the ABMS boards. Is that right?
That's correct, although the ABMS can make an exception and have non-psychiatrists be allowed to take the addiction psychiatry subspecialty board. But the psychiatrist and the ABMS would both have to agree on that, and that's something that's not currently done.
Is that something that's been looked into? Has anyone tried to do that?
Well, it's on the list of possibilities. I think as the study has gone on through the American Society of Addiction Medicine, and that group has been looking at the issue of specialty status in addiction medicine for over 20 years, that there seems to be agreement that addiction psychiatry and addiction medicine, while there is an overlap, they are not identical. And so that's one of the issues that we're addressing now at the American Board of Addiction Medicine.
What is it that an addiction medicine specialist might be able to do or have expertise in that an addiction psychiatrist wouldn't, and vice versa?
That's a really good question, and maybe the way to move into that and bring me back if I get off is to talk about the American Board of Medical Specialties themselves. There are 24 current approved medical specialties and about 100 subspecialties under the various specialties. And they have evolved with time, and there's a great range of what the specialties and subspecialties are. For example, the American Board of Internal Medicine is large and encompasses adult medicine in many manifestations, has many subspecialties, and the American Board of Colorectal Surgery really deals with the last 3 feet of our bowel. And so you see there's a huge difference between the specialties themselves. They arose as a societal need and a health professional need for certification and higher standards arose. If we go back to the mission of the American Board of Medical Specialties, their mission is to improve the quality of medical care, and they do that by establishing standards for physician specialty certification. So, as medicine has evolved, as society has recognized other problems, as health professionals have said we need to do something a little different, then a new specialty will arise. When addiction psychiatry as a subspecialty arose, I guess about 14 or 15 years ago, at that time there was also a view that addiction medicine could become a subspecialty. There seemed to be a need for more physicians that had a measurable and demonstrable quality of care, education, etc. in the field of addiction. Well, obviously addiction psychiatry, because of psychiatry and because of the many, many psychiatrists that practiced addiction, they were at the forefront of that. They already had the American Board of Psychiatry and Neurology, etc. So that path was a little bit easier. As society has looked over the last 20 years, or even since the addiction psychiatry became a subspecialty, we have seen a huge growth in the understanding of what addiction is, both in terms of brain science, its impact on society as a whole. Just look at our prison system, for example, on its impact on other medical diseases and trauma, And we've got new treatments, both pharmacologic treatments, and we have a better understanding of what outcomes are achievable through non-pharmacologic treatments. So there has been a change in not just the health professional view of addiction and its treatment, but in the societal need to address it. Currently, and I think all the psychiatrists that I talk to, and certainly the ones on our board, the American Board of Addiction Medicine, realize that there are probably not enough psychiatrists and certainly not enough addiction psychiatrists to do all that needs to be done in the broad field of addiction. And the problems that we face with persons with addictive diseases that they face can impact every organ system as well as every social system. So there's a growing consciousness in health professionals, and I think in the nation at large, that we must do something as a nation and as a profession about the issue of drug abuse, substance abuse, and dependence and addiction in our society. And I think the American Society of Addiction Medicine has been at the forefront of this, and the American Board of Addiction Medicine is looking to see where can we make an impact, how different are we from addiction psychiatry to meet the unmet needs that exist today.
So would it be fair to say that an addiction medicine expert is at the intersection of addictive disease and internal medicine, and an addiction psychiatrist would be the intersection of addictive disease and psychiatry, or would that be putting too fine a point on it?
That's actually a very good point, and we are not clear whether addiction medicine should be a subspecialty or a conjoint specialty, and it has to do a lot with the question you ask. So, for instance, when the American Board of Family Medicine was begun, it was sponsored by a number of other groups, the American Board of Surgery, American Board of Internal Medicine, OB/GYN Board, the Pediatrics Board, the Board of Psychiatry and Neurology, etc. And within family medicine, of course, there are many who subspecialize. There are certainly many internists and many psychiatrists that spend all or most of their time treating addictive disease in some way. There are also family practice doctors, there are also obstetricians, gynecologists, and family medicine doctors that, while they have their primary specialty, are spending most of their time or even all of it working in the field of addiction. So one big question we have is that should addiction medicine be a subspecialty of many specialties, or should it be a freestanding, what we would call a conjoint specialty? And addiction psychiatry, under psychiatry as a board, psychiatry also has other subspecialties, and it may be that we'll see someday a pediatric subspecialty of addiction medicine. So every specialty that deals with patients and their families will have some interface with addiction, and someone has to be the referral source for the other physicians there and for the families.
Thank you. You're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Dr. Stu Gitlow. We're speaking today with Dr. Kevin Kunz, Interim President of the American Board of Addiction Medicine. Dr. Kunz, we've spoken a little bit about the direction that things are likely to go. Tell me more about the American Board of Addiction Medicine. When did that begin?
The American Board of Addiction Medicine was incorporated in August 2007, and its purpose was to establish and maintain standards and procedures for certification and recertification in addiction medicine, and also to evaluate physician specialists and accredit training programs in addiction medicine. Now, the American Board of Addiction Medicine receives support from the American Society of Addiction Medicine, as many new specialties and subspecialties do from others in the field. And the American Society of Addiction Medicine agreed to encourage and assist in the development of an American Board of Addiction Medicine for many reasons, and I won't go through them all now. The American Board of Addiction Medicine's first task is to receive information and study from its counterpart foundation, the ABM Foundation, to actually define the field of addiction medicine. How is it unique? How different is it than, for instance, addiction psychiatry? What would the training look like, the graduate medical education training? What would the curricula look like in those training programs? How does organized medicine, the public, and other health care providers view the need for it? So that's a lot of work to do. And this defining the field of addiction medicine, and every specialty and subspecialty has had to do this. What's the core content? What is it that makes addiction medicine a specialty or subspecialty? What do we expect the physicians to be trained for and to accomplish? And what would their practice look like? So while we have some pretty good ideas on this, we're now settling down to doing the work of working with other specialties, seeing what's out there and defining it.
This sounds like it is likely to be a very long process.
Well, we know that American medicine changes to meet the needs of the public and the public health. Change does not happen quickly. We feel that the time has come that this nation, and we as this nation's physicians, must address the huge toll that we pay in every way for the disease of addiction. We are prepared for the long run. We do not expect to have this done in a month or a year, but we will pursue it. We will work within the system that says, let's look at the big picture. We will work with every other board. We'll work with the American Board of Medical Specialties. We will get input as we have, and we will continue to listen to how best can the field of addiction medicine serve medicine in general and serve our patients and their families.
So I opened by giving a congratulatory to a new physician board certified in addiction medicine. How long do you think it will be before that actually happens?
Well, I anticipate that the American Board of Addiction Medicine will give its first certifying exam within a few years. Before that board basically becomes a member of the family of medicine by being incorporated as an American Board of Medical Specialties specialty, we will have to have training programs in place, and we'll have to have the core competencies and content I've talked about. We'll have to work with many others in the field. My estimate is that, we're at least 3 years away, and more likely, perhaps 5 or 7.
Okay, and you've come in as the very first president of the American Board of Addiction Medicine, is that right?
Actually, I'm the interim president. Our board will be fully staffed with 15 members at our next meeting on September 2nd and 3rd, and a president for the next 3 years will be chosen.
And your specialty is preventive medicine?
I'm board certified in preventive medicine and public health, and I've worked in community clinics my career. And of course, if you're in preventive medicine and public health, it's not difficult to see that the number one economic cost to our society and the number one problem of our patients, and the CDC says this and the Robert Wood Johnson says this, is substance use disorders. So if you're looking at a big picture, it's easy to see in preventive medicine that if we could deal with addictive drugs, from nicotine to alcohol to methamphetamine, the pain pills that are prescribed, if we can deal with those when they hurt individuals, we will save our society and our patients and our families much grief.
Well, that's the perfect summary. Thank you so much for all your work in this area. My thanks to Dr. Kevin Kunz, Interim President of the American Board of Addiction Medicine. I'm Dr. Stu Gitlow. You've been listening to the Clinicians Roundtable on ReachMD, XM 157, the channel for medical professionals. We welcome your comments and questions through our website at reachmd.com, which now features our entire medical show library in on-demand podcasts. Thank you again for listening.